Thank you so much, sir, for the kind introduction. And at the outset, I would like to thank Dr. Purvi Chawla, Dr. Manoj Chawla, Dr. Bhondve Sahu for giving me this opportunity to share my insights on how AI can be used, the tools AI can use. So already the context is already set. Some of us are already partial experts into how AI is being used, but to tackle the day-to-day scenario, we are really out of time, and nowadays we need everything quick. So yes, we need everything quick. Everybody knows about this scenario. We want it quick, right? We also want it very quick, right? And again, pretty much quick. The results what we need are to be quick, but whether these results are meaningful, but we really don't look up to it. So what I'm going to do is, my job is to share you with some of the AI tools which will probably help us to read the articles quickly, yes, but of course meaningfully. So we'll talk about the research assistants and search engines. Then there are some tools for summarization and simplification, and there are some tools for critical analysis and context. And finally, the right prompt. Of course, the right prompt has already been dealt with, but we'll see the right prompt scenarios in the repeated context. So yes, so there are some tools which will help us read the search engine, like that a search engine we can use. There are some tools which will assist us to go deep into it, and there are some tools which will help us to write the articles also, something like systematic reviews as well. So we have Elicit, we have Consensus, we have Semantic Scholar, and we have SciSpace. Okay, so what I'm going to do is there'll be some presentation, and I'll have the actual real videos of my screen recording that how AI is getting used. So semantic search, Elicit helps us semantic search. Semantic is basically play of words which gives us an output. So we have to make sure that we are using the right words, again, which also insinuates to the right prompt, and it automatically extracts the data. We really don't have to use, of course, we have to use the PubMed and Embase for that, but this helps us to go to, we really don't have to learn the mesh terms. We don't have to really learn the booleans all the time, but we can still do it. And it also gives us a transport sourcing, and it also gives us the workflows, how it goes. So how it goes, yeah, great. So Elicit is going to use us. So I've done these videos really fast. So just put in the hot topic, impact of empagliflozin and dapagliflozin on HbA1c levels and blood sugar levels, and if at all there are some side effects, adverse events. So it is going to give, see, as soon as I typed it, it's already started generating the title. It is going to give us a summary on top. There are some resources it has come out with. Okay, and it is giving us the entire context. Okay, all the studies you can see here at the bottom, right? So you can search the studies, you can put in what you want summaries, you want main findings, methodology, all these. At the same time, it also is going to give us that who's the author of the research of that particular article, and as well as how many citations it got. You can go to those citations also. So that semantic workflow view I was talking about, it is that. So it is going to give us the data which will help us, and ultimately it is also going to give us in a tabular format like this abstract summary. It is going to give, it is more effective than the dapagliflozin reducing HbA1c. So yes, rather than reading the entire article, you can just go to the summaries, abstract summaries, if you're really quick. Okay, so now we have another tool called Consensus. It is add an additional feature of Consensus Meter, and it gives you a fact-based answers. Okay, it also can talk about, like, how much is the reduction, how much HbA1c has gone down, and that also can be given. So there are three different search mode. There is got a quick search mode, there is got a pro search mode, as well as the deep search mode. So we'll see that in the Consensus setting also. Yeah, so again, the similar question what I have done is impact of empagliflozin and dapagliflozin. What it is given is the specifications of the studies also, right? Whether it is an RCT, whether it is a non-RCT, whether it is human trial, large human trial, smaller human trial. Okay, and it is also in an addition gives us and comparative data and safety here, as we can see here. It also and gives us the citations also. You can backtrack the citations where it has come from. Maybe, as one of the speaker already told us, that there is a chance that ChatGPT gives you fake made up studies. it is going to give you fake made up studies unless until you give a good prompt. So rather than that, you can actually back check all these responses, and also it gives us the study design, whether it is a large trial, small trial, whichever trial it is, how many citation it has got. So that way it is helpful. So it has got an additional feature of consensus meter, which tells you that all the authors on this context, whether they have a consensus on this particular topic or not. Yeah, so that is an extra added feature for the consensus. Yeah, semantic scholar, it's more of an old semantic scholar which we are using. It just gives us citation maps. It has got a very peculiar TLDR thing, too long didn't read, so one line summaries, that's it. So how does it give one line summaries? How does it give one line summaries? Yeah, so you just put in empower versus DAFA, and I want to know that what is the kidney outcome. Of course these prompts are not correct, I'm just giving you like in a very generic context. Yeah, so it is giving that TLDR, too long didn't read. Very clear. I just want one single thing, and I want it to compare with all other things. Yes, if you want to expand it, you can really expand it and read it a little bit more, but you can still stick to that one-liner thing. So what I've done is I've expanded it, and I wanted the data with what exactly it is talking about. Yeah, and I just highlighted it, and I know what exactly it is doing. So yes, Semantic Scholar has an additional AI interface with it, but it still works like the older typical semantic way. Yeah. So SciSpace is one good for literature review. It again gives us a semantic search, and for additionally in case of an paid version, upgraded version, it also gives you a PDF video podcast. Okay, it can give you a video podcast that you can actually chat. Whatever chat has been done with you and the tool will be given to you in the format video podcast model also. So it converts research paper into video or a podcast summary. So SciSpace, again the similar study, it is analyzing it, and then it is going to give you at the background with the live activity. You can actually look at how this particular tool is searching at the background. What is happening at the background, that also you'll be able to see, and how many spaces it search. It is searching SciSpace, it's searching Google Scholar, it is also searching PubMed, all these terms. And what an additional feature it is give you that some of us might struggle with it. It's also giving us a free PDF link that you copy that link and go to the paper as well. Okay, so that one also do. We know that there are quite a few unofficial things on internet that we get the free papers on, but still in a manner where we're talking about ethics and all, it's better to go ahead with that. Okay, so it gives you PMID number. It also talks about which journal, and yes, this is the mesh thing also. If you want to learn the mesh, that what exactly mesh terms it is used, you also can use with that, with this particular tool as well. Yeah. So this is the mesh term which it has used with the PubMed. So you also can learn the mesh with this particular thing. Yeah. So there are some tools for summarization and simplification. So what we have done till now is just searching, like a kind of like a search engine. But now I have finalized one final paper and want to talk this paper. I want to chat with this paper, and I want to see that what exactly is it talking about. So first thing is explain paper. So it is going to go.
Unfortunately.
Yes. Yeah. So we have to highlight and explain interactive question and answer session, support for technical content, and it will adjust the complexity as well. So explain paper, just upload the paper and it will give you the highlight the text, and it will explain it to you that what exactly is happening, and it will also help us to understand the paper. ChatGPT, our own ChatGPT will help us. It is just that you have to go to GPTs and download this AI PDF version of it, so that then only you will be able to understand and chat with the overall thing. Yeah, Scholarcy is one good thing which I really like about is it gives you flashcards. Okay, it also gives you important outcomes, important points, wherein you will be able to only get the important points which you are interested in. Yeah, so it will highlight you those points that what exactly you are looking at with one paper. Yeah, and then finally for critical analysis and context, if you are doing a lengthy research, or you're doing citation work, you are doing writing papers, so you have core features, you have site.ai, it will be helpful for you all. Currently we are using Zotero and Mendeley's for the citations, but it is connected with the Zotero and Mendeley also. So you can just do that, put in, and all these citations you can download as a BibTeX format later on for your Mendeley's and Zotero, and it will be saved in your Mendeley or Zotero platform as well. That's site.ai. Research Rabbit is a fantastic tool wherein you just put in the study, the name of the study, and it will also give you a fantastic map that which researchers have done that, how these studies are connected. You can cross-ref it back to the original articles also, and you can actually click on the individual studies. You can see the maps, and there are some research and co-researchers also, so you can actually track them. You can also track them chronologically. That's the beauty of it again. So Research Rabbit is a fantastic tool for research again. So PaperDoc, again, similar kind of a thing wherein you just upload the paper and it will give us the context of all the studies which are, and this is an additional feature. Does empagliflozin, dapagliflozin impact HbA1c levels? If you want to read the studies which are only talking about yes, you can highlight those. If you want to read about only no, you can highlight those as well. So that's a PaperDoc for you. And then Ryan is more for the people who want to do systematic reviews and meta-analysis using ChatGPT, using the Ryan model. Again, these are the paid versions. You just have to upload all the studies, and Ryan might be helpful for you all for screening, full screening and data extraction. Yeah, the right prompt is important. Yeah, vague prompt is tell me more about diabetes, and then there are effective prompts. What is the best treatment for diabetes? Again, so vague prompts are not just the prompts for in general for all the tools. You have to learn, or you'll have to train that, as Modi sir already said, you have to train that model, that how you think, similarly the AI will think for you. So for each tool, the prompt is different. You have to get that hack in the original. So all these are there. Oh, sorry. So actually I had given the, because it's a Amchi Mumbai kind of a conference. So this is my final slide, which talks about how meaningfully and quickly. So quickly is quick response. So these were the vada pav emojis, and these are actually chili emojis, because you go with the vada pav and you have a mirchi along with you. So elicit, in terms of quick response, yes, it codes 5. It has got a good meaningful extraction as well. Consensus, it has got, again, almost quick it is, but meaningful extraction you really doubt, because ultimately it is judging consensus meter on its own. But ultimately what we have to decide clinically, it's up to us, right? And then semantic explorer, it is really tedious. It's more like a manual thing only, but it is going to give you meaningful extraction later on. And all these tools are going to help us. Specifically Ryan, not good for the ones who really want to just stick to the clinical part of it, but will be helpful for the people who want to do systematic reviews and possibly meta-analysis. Meta-analysis tool is not really very well developed with Ryan, but the systematic review tool is pretty much very well developed. Research Rabbit is something which I highly recommend, because it just gives you that context overall, and will be helpful for you all to track the authors as well. So at the outset, thank you so much for giving me this opportunity. That's all from my side. Thanks.
Thank you so much, Dr. Amit. Wonderful session indeed.
Thank you so much.